Hello, and welcome to the Tracy Show. I'm going to get right into it. People, black, white, Chinese, I don't care what color you are. We are in a serious health crisis. Serious. September 30th was the end of the fiscal year of 2025 for the federal government. If the Congress does not pass a continuing resolution or the remaining budget bills for fiscal year 2026 by the date, then parts of the federal government will shut down, with many federal workers being forced out on furlough and many federal programs running out of funds. Today, President Trump and Republicans insisted in shutting the government down rather than fixing a healthcare crisis they created. Costs are skyrocketing, rural hospitals are shutting down, and people are losing access to life-saving coverage. And instead of putting a stop to it, Republicans have taken our government hostage. In response, Protect Our Care President Brad Woodhouse issued the following statement. Republicans ransacked American healthcare to provide tax breaks to billionaires, and rather than fixing the healthcare crisis, they have decided to shut down the government. They already owned a healthcare crisis, and now they own a government shutdown. People, this is not a game. This is not a drill. There is no do-over. Please listen to the messages that I have put together for you. Many people will die. Families will not have coverage. Black and brown people will not have coverage. White rural won't have coverage. Just listen. Just listen. It's not a game.
Directly to Speaker Johnson in the Oval Office. I told him what he was saying was bull, because he said, you guys want that. And he just smirked, didn't even answer. And why are they lying? They know how unpopular their position is on health care, but they shouldn't talk about it. Republicans know perfectly well that undocumented immigrants are already prohibited, as I said, from getting insurance on ACA, Medicare, or Medicaid. They know perfectly well not a single sentence or clause or comma that we're pushing in our bill does that. But they're lying because they know they're screwed if this debate turns into one about health care. And guess what? That's just what we are doing. We are making this debate a debate on health care. I'll take all my papers here. Thank you.
Well, there is less than 12 hours to fund the government. House Republicans aren't even here in town, they're on vacation. Meanwhile, Senate Republicans are about to force another vote on a bill that already did not pass, and that 8 of them did not even bother to show up to vote for the first time. And Donald Trump, well, the president is resorting to AI deepfakes and bold-faced lies because the actual facts are pretty bad for him here. So here are the facts. Healthcare rates are being set right now. Open enrollment is weeks away. Idaho open enrollment starts October 15th. So American citizens are about to see their premiums skyrocket. In my state, family paying $238 per month for their health insurance right now. Thanks to Republicans, they could pay as much as $1,800 per month next year. Look, is the president totally unfit to hold office? Yeah. But it is not about that. This is about health care. He is choosing to shut down the government rather than work with Democrats to fix the healthcare crisis Republicans created. If it seems like the only sentence that Republicans can form these days consists of a noun, verb, and illegal immigrant, that's because they have to resort to outright lies to defend their truly god-awful healthcare policies. Their attacks on healthcare are already hurting American citizens, millions of them. There is no getting around it. Cutting healthcare by more than $1 trillion, hospitals are already laying off staff and closing down across the country. Millions are going to soon be kicked off of their healthcare. So Donald Trump can lie, J.D. Vance can lie, but people are still going to get those letters in the mail telling them how much more their health insurance will cost next year. Now, apparently, when President Trump was looking over Democratic health care proposals, he said, and I quote, "Go F yourself." That tells you how much Donald Trump cares about whether families go bankrupt paying for their health care.
Thank you, Senator Schumer, and to my colleagues. So yesterday, after weeks of waiting to see if the president would lead Senator Schumer and Leader Jeffrey go over to the White House, this is not a joke. People are literally standing on a healthcare cliff right now. For members of our caucus, when the Republicans, a whole bunch of them, didn't show up and vote last week, what did our people do? We went out and we met with the people in our state. We met with doctors and nurses. We went to rural hospitals. We talked to people that can barely hold on right now. This, what one farmer called a perfect storm of ugly. The tariffs are hitting them, the markets are drying up, and now they have their healthcare costs. So many of them, especially in rural areas, are on these individual plans. So what does the president do after this meeting? He posts that deep fake offensive video. This isn't a joke. This isn't political theater. He's so proud of the art of the deal, and it is his time to lead. He has said repeatedly, and you've all seen the real videos, where he said this is a time for a president to lead in the past. Well, this is his time to lead. When we talk to the people out there that aren't the ones on the Mar-a-Lago golf course, you hear what's really happening. They look at those grocery bills, they look at their electricity bills. Those things aren't deep fakes. Those things don't lie. Those things are real. So what are they facing? Healthcare cliff. 20 million Americans are set to see their premiums double when they pick a plan starting November 1st. And for those of you that ask, why are you doing this now? This isn't a December thing. This isn't a January thing. This is a now thing. This is happening right now. And the only way to fix this is to do something about it now. Those families that don't know if they're going to have cancer research, and those researchers on Alzheimer's that are looking at going to other countries and looking at what's happening with NIH, this is a now thing. So I hope people remember that this is not a funny deep fake meme. This is not anything he says. And for those people in my state that voted for me and him, and there's a lot of them, they actually thought he'd bring costs down. That's what he said would happen on day one. Well, it is day 253. And people are paying more for their prescription drugs. They're paying more for their beef. They're paying more for their groceries. And they're paying more for their electricity. And they're sure paying more for their health care premiums. This is his moment to lead.
Here's the bottom line. In a few hours, tonight at midnight, it is very likely that the United States government is going to shut down. And I want to just take a minute to explain why that is happening and how it is happening. In the U.S. Senate, there is a rule, it's been around for many, many decades, which says that in order to pass a budget, which is what we're considering right now, you need 60 votes. And I guess the people who put it in did that because they wanted bipartisanship. They didn't want one party just to be dictating the terms. That's what's gone on for decades. And under Democratic and Republican leadership in the past, that is what has happened. Agreements were reached in a bipartisan basis based on negotiations. People talked to each other. This year, we are in a different situation. Republicans, as everybody knows, controls the U.S. Senate, controls the U.S. House, and controls the White House. In other words, they are running the government. But what is happening now, which has never happened before, is they are not sitting down and negotiating. Yesterday, Trump met with the Democratic leadership, the Republican leadership, said hello to each other. Wasn't really a negotiation. So as of this point, Democrats have had no input into the process at all. Now, what Republicans want is to pass what is called a clean CR. In other words, maintaining the status quo. And some of you may say, well, what's the problem? It's not bad, it's not good, we'll maintain the status quo. Here's why that is an awful idea, why all of us are opposed to that. In the last year, as many of you know, under Trump's big, beautiful bill, which to my mind was one of the worst pieces of legislation passed in modern history, under that bill, 15 million people on Medicaid and the Affordable Care Act will be thrown off of healthcare. A number of studies out there have suggested that up to 50,000 Americans a year will die.
This is not a game. This is so serious. So serious. And anyone who can't see this, something is very wrong with you. What in the world? Just think about your parents or your grandparents. Think.
Because they are no longer able to go to the doctor. Very shortly, you are going to be receiving notices from your insurance companies that your rates, your insurance premiums are going up by, on average, some more, some less, 75%. Yeah, you heard that correctly. 75%. Now,
75%. That is almost a 100% increase. Soon we will be making decisions. Do we buy eggs, milk, and bread, insurance, or do we pay for health care? We are in trouble. This is sick and this is
right now,
scary.
we have a broken healthcare system. Nobody can afford healthcare. You're ready for a 75% increase in your insurance premiums. You're not. Nobody is.
Anyone that would take health care from us, Americans, is crazy. They are sick and delusional, crazy. And then people could lose their jobs. If you don't have your health, you don't have anything. If you don't have your health, how can you function? And this is what they want. This is insane. This is sick. And this needs to be stopped ASAP. I don't know the magic thing to do to stop it, but we are going to be living in hell. Guys, please share this video. Please like this video so that it stays in the algorithm, because this is so important. Please leave your comments. I would love to know your thoughts and opinions on this. I will be so glad when Trump is out that office. I don't know what to do. I don't understand why they just don't put that man in jail. This is crazy. If you have your parents or your even if you have a child that needs special medical needs, special medical needs, it's going to be gone. Or it will be so high you will not be able to afford it. And sadly, people will die.